Now, there are a few caveats for that. We do know now that with the number of people who have been infected, tens of thousands of people, and of course that also means several people have survived, that there can be latency of the virus in certain parts of the body. Now, this is not a risk to the general population, but it does mean that if somebody has been infected in the past and they start to redevelop symptoms, they can pass it on at that time. And so we may see sporadic cases of Ebola popping up in any of the affected West African countries over the next couple of years. And this should not be a cause for alarm. We've learned very quickly that with commerce the way it is and international travel the way it is, that things that happen in previously isolated parts of the world very much can impact us here in the United States. And it's important not just for us, but to help those in developing countries to prevent these sort of infections from happening to begin with. There's a lot of things we've learned. A lot of this relates to paying attention to what's going on in developing countries, trying to improve the public health infrastructure in these developing countries, but also reacting to these types of outbreaks quickly so that they are stopped almost as soon as they happen. We are all cautiously optimistic that this marks the end of the Ebola outbreak, knowing we may see some more sporadic cases. But now is not the time to celebrate, but rather to reflect on what do we do next. And how do we ensure that the next Ebola outbreak, and there will be others, are stopped quickly before tens of thousands of people die again.